If you have a well-functioning cell membrane, your mitochondria repels parasites. There was a study that was done, they're looking at toxoplasmosis, which is obviously very toxic parasites. They noticed that toxoplasmosis end up having to eat off of the fatty acid that the cell membrane is utilizing.
No way.
Yeah, so that's how they grow. They feed off of it.
No way.
They feed off of it. So what cell membrane is trying to do is trying to outcompete in doing that, but they notice that mitochondria comes in, blocks that from happening. So when you have a mitochondrial dysfunction, what's more prevalent? Parasites.
Welcome to the Ancient Health Podcast, where East meets West in the world of medicine. I'm Dr. Chris Motley. Let's bridge the gap between ancient practices and cutting-edge medicine. Let's get started. Guys, thank you for joining me today. I have one of my close friends where one of our first episodes got literally lost. I don't know where it's at, but Dr. John Kim, he has been a doctor of pharmacy for over 2 decades. And I met Dr. Kim at a conference and I resonated immediately. And I don't just say this lightly. He's Korean. I'm half Korean. And we know some of the same like cultural activities and I don't say stigmas, but like some of the things we're used to in our family life, right?
It's a stigma.
It's a stigma.
And little pet peeve of being a Korean, right?
That's right. And I when we talk about or hear him say some different things that he experienced in his family, is like, yes, I've experienced that. And but I'm so grateful you're here with me today. So I want to brag on you a bit. And you have been on big stages, and you have been speaking about cell danger response. You've been talking about hormones, mold toxicities. He was on Gary Brecka. He's been on Daniel Papa's podcast. He is being invited to speak all over. And I mean, truly, look at his social media. He has just done amazing. But it's info, and I say this all seriousness, that is needed, and it's practical too. It's like you need to get this because you may experience these types of symptoms. And I know we like to go through the background because I love that. I think that we're going to dive into that. We're going to talk about how your cells don't operate or they don't get activated properly to give you energy and healing. Maybe talk about some cellular health, definitely. But I do want to jump in a bit because you have the best in a very like story in your background of how this came about.
Yeah.
Like what happened to you? Because some people love practitioners that went through the fire, and you did. Can you tell us about that story, which is totally awesome?
Yeah, so my story is pain to glory. I think that a lot of practitioners, including you, actually have a pain to glory stories, and that's the reason why we got into this. But long story short, back in 2015, I had a heart attack. NSTEMI to be exact, I had an 85% blockage in my LAD, ended up getting a stent put in.
Wow.
And one of the mystery part is that 6 months prior to having a heart attack, I went to my doctor, got a conventional labs done, checked the cholesterol, everything was normal.
Yeah.
Having an EKG done, that was normal as well. But then why is it that a 33-year-old end up having a NSTEMI, having a stent put in as being the youngest patient to get a stent putting in that hospital, and then having to wonder what had happened. What did the doctor end up having to miss? And to be honest with you, I completed my fellowship in functional medicine through A4M back in 2008.
Yeah.
And I was mainly working with female clients dealing with hormones and leaky gut. And I thought that was something that I already knew and mastered. But there was a lot of alarming issues that I was going through that I was completely ignoring as a person. And the unfortunate thing is that people listening out there, practitioners are the worst patient possible because we know how to help patients, but we don't know how to help ourselves.
Yes,
right. That's the reason why you talk to other practitioners and such. I mean, obviously, you reached out to me 2 years ago into talking about your mom's case.
Yes.
Right. So things that we could do and we cannot do. But thing is, there was a lot of alarming signals that I was already dealing with leaky gut, having to have major neuroinflammation, anxiety up the wazoo. You're talking about having really bad breath, skin breakouts all over, including acne. So there was a lot of telltale signs there was an issue, but I didn't realize the problem until actually having a heart attack. And then having to sit in the ICU unit for 3 days, getting out, getting home, and then having to question whether I'm going to have a secondary heart attack. That's when I decided to do a much more deep dive. But first, before I did that, I ended up just wanted to get a IV vitamin C done. And my integrative doctor asked the right question: are you dealing with some kind of tick-borne illness? I'm just like, there's no way. So that's when we decided to do additional testing and found out that I was tested positive for Bartonella infection. Wow. Heavy loads of mold mycotoxins, Mycoplasma pneumoniae, parasites, heavy metals, and Epstein-Barr. So telltale sign of the overall biotoxin load was overwhelming, and I didn't even factor in terms of childhood trauma, and then, stress of running a business that was almost failing, and then having to go through that and getting out of that huddle. That's when everything just started to crumble.
Wow. And when it's crumbling around you, and when you're in the hospital, you get this information back and you start to notice that these are the infections. What was your first response? Like, you got the IV. Did you just do a deep dive in these infection states and the things that you found out through this testing, and you're saying, I'm going to master this, or like, I've got to clear this out of my body?
No, I mean, initially I didn't believe in terms of even having to do that, right? So even before getting to that phase, back in 2010, I did a certificate training through Defeat Autism Now. That group is no more, but that DAN group was a group that actually trained clinicians, doctors and MDs and pharmacists, how to tackle biomedical treatments for autism spectrum disorder. That's where I actually learned a lot about mitochondrial dysfunction, cell membrane, talking about heavy metals, and including how certain biotoxin and co-infections leading into a diagnosis of autism spectrum. We talked about the dangers of vaccines and how when you're giving an overload of antigens, this is where the issue dealing with the fact that autism spectrum is not obviously neurological issues, but more a autoimmune condition that the child is going through. And this is a part that was taught to me. This was back in 2010. So I knew all this. And we know that now much more. Yeah. But we knew this information back in 2010. A lot of the information has been squashed, and unfortunately that group is completely dispersed. But that's how I started. And so looking back, you get to connect the dots in terms of why certain things didn't happen in life. And then now, being that I went through my own healing journey in dealing with the Bartonella and mold infections and how that relates to cardiovascular issues, and knowing that, transitioning into helping clients now dealing with biotoxin issues, specifically mold toxicity, MCAS, and long hauler issues that we see, and how that's all related to generally mitochondrial dysfunction.
That's right. So with mitochondrial dysfunction, when you got to that realm and you knew that the cell was not getting energy, mitochondria being your production of energy, did you find that for you, you dove into really learning or healing your own cellular energy? Is that where you started the first fight against some of these infections?
I wish I could say that, but I had very good teachers and practitioners that actually helped me at that route. Again, you cannot help yourself sometimes. You have to have the community to help you. And I had a great doctor. At that point in time, my blood work was sent over to be analyzed over at Body Bio. I don't know. You know Body Bio.
Body Bio, yeah.
The Body Bio is a supplement company. They make amazing liposomal phospholipids and balance oil.
Yes.
And the founder, Dr. Ed Kane, he's the one who actually analyzed my blood work and then gave me the customized lipid therapy, lipid membrane replacement therapy that followed through. So I did IVPC. Obviously, oral PC is another thing that I'm still continue taking, but I took at that point in time that really helped to understand how these biotoxin issues end up having to impact cellular function. And then when your cells are not functioning very well, you cannot heal your body correctly.
That's right. So the membrane has to be healed. It has to be supple enough for the actual energy to enter into the cell. And when you talk about cellular health, and I'm not trying to sidetrack, but one of the greatest things I love hearing you talk about is not only can the health of the cell, and we'll get into like the actual structure and mechanics, but I like when you talk about cell danger mediated responses. And
I actually lecture a lot about the discussion of cell danger response. That was a coined term by Dr. Robert Navio, MD, PhD out of UC Davis. And the reason that I got into that interest was the fact that I keep seeing clients who are stuck and not able to get the resolution in their health issue they're looking for. And when I dived into Dr. Robert Navio's work, and he started working with the autism spectrum disorder, and really looking at why kids are getting stuck in their healing process, what's going on really. And what the interesting about cell danger response is a protective mechanism your mitochondria actually brings forth to prevent further damages from the actual biotoxin and toxin issues, including stress response.
Wow.
So it is a evolutionary aspect of it, right? So I'll give you a certain context. So some of the stresses that we see, and you know this too, and you mentioned about this a lot. You're talking about biotoxin issues, specifically biological issues such as mold, parasites, viruses, and then bacterial infections.
Yes,
we already know that. You also have all the chemical-related issues in terms of creating the danger signals in terms of heavy metals, glyphosate. You're talking about BPA. Those are all things that we already know. And then you're dealing with physical issues such as traumatic brain injuries. Now we have to talk about non-native EMF issues, including UV and UVB radiation issues there.
Wow.
So it could be X-ray, it could be radiation from chemotherapy. Those are all danger state. And then the last thing that we don't really often talk about is how emotional traumas, right, resulted in this. So those are all issues that creating cell danger response state. Now, the interesting part is that the mitochondria, instead, we know that mitochondria makes energy. Everybody knows this. A lot of people actually know this. Unfortunately, mitochondria also dictates how these things are getting processed. So instead of making energy, the mitochondria shifts from creating energy, which is creating ATP, but oxidase phosphorylation, now switches over to glycolysis, and then which is the most ineffective ways of creating energy, but now going to a defense mode. So mitochondria senses everything from the pathogens coming into the body, into the cells, and then trying to contain the particular damage by pumping out phospholipids and ceramides in the cells to lock that pathogen in. And on top of the fact that the mitochondria increases a level of antimicrobials to neutralize the danger. And the most important part is the fact that mitochondria shuts down DNA methylation. And
so
we know
it shuts it down.
Shuts it down. And this is the explanation in terms of what Dr. Robert Navier actually had done. And reading that, I'm just like mind-boggling in terms of how and why methylation aspect of it is poor. And then us practitioners end up having to think about just giving methylated B vitamins is going to fix the problem. Matter of fact, we've seen reactivation Epstein-Barr of just giving B vitamins, and why people are getting so sick is that alone, that the mitochondria dictating, and to prevent further damages and preventing further reactive oxygen species from forming, the mitochondria shuts that DNA methylation down. On top of that, now the mitochondria dumps out intracellular ATP outside the cells to act as a signal molecule to other cells that there's a danger state going on, and that ATP is something called danger-associated molecular patterns, called DAMP. So it's an extracellular ATP that the cells are now detecting there's a danger state going on, that we need to shut down other oxygen consumption, making ATP. This is the reason why people are sick. They have, and one of the things that you also mentioned, like mold toxins, for instance, what's happening? Brain fog is the biggest issue. Why? Mitochondrial dysfunction.
That is amazing.
And then when the cells are going through this whole danger state, that is where sick signaling, right? People getting sick, people are fatigued, people are completely having to rest.
Yeah.
And another phenomenon that occurs is, why is it that people getting stuck in their healing process?
Yes.
Because if there's a constant ongoing issue with dealing with cell danger response, constant exposure to the particular danger, and even then, even though let's just say you are exposed to mold, we'll discuss more about it later, even though you might have been exposed to mold, when you moved out of that moldy environment, getting to a cleaner environment, and these people are still sensing an issue dealing with the mold symptoms, is because that whole damp signal that I mentioned about, the body does not know that they're out of danger. So the whole cell danger response issue is that it's an ongoing cyclical problem, and people don't know how to resolve that on their own. And the issue is that we have to allow the reprogramming of that and sensing and bringing safety aspect back into the cells in the mitochondria to relieve it. This reason why people are dealing with severe MCAS issues these days. Yes. Right? Hypersensitivity issues to EMF, into other environmental issues, overreactivity to certain scents, right?
Yes.
All these things that we see this as could be a common thing, but what that explains is an ongoing cell danger response state, and there's no proper resolution that's been taken care of. Wow. That's the reason why.
I'm not kidding. Mind blown, guys. I love the way you described it. And I just go back in my mind. This is how I process. So when they are dumping that DNA particulate, like let's say from that damaged mitochondria, and it's inside the cell and it's signaling to the other cells, like there's something in here. And when the cell gets injured, does the DNA particulate, does it damage the cell wall as well? Like, your mitochondria gets and the cell wall gets damaged and it starts leaking out, and then that's when the other cells just sort of go crazy and say, let's...
Right. But so another issue is that because if there's an ongoing sense of threat, the mitochondria, I mentioned about how the cell membrane is completely locked because it's trying to contain that particular damage. Unfortunately, that also leads into the lipid membrane. So if you look at biology, when we were in kids, we learned about how our cell membrane is a bilayeral structure. You actually have the phospholipid bilayeral structure on top, outside, and then you actually have the inner membrane, which is comprised of linolenic and alpha-linolenic. There's a lot more. There's a cardiolipin, there's certain cholesterol, and ceramides that are giving the structure of the overall cell membrane. But just to make it clear is that there's a bilateral structure. Now that membrane has to be intact for you to absorb nutrients in, debris out, right? It also, well-functioning cell membrane allows hormone signaling to occur. There's different receptors for peptides to work well, including other signaling, including medications. How it works within the receptor is well-functioning cell membrane. Unfortunate thing is that mold toxins, because that's the discussion we're going to have, mold toxins, specifically mycotoxins, cause damage on the cell membrane. It actually causes lipid peroxisomes, right? So actually basically oxidize the fat in the cell membrane. Okay, and also the fact that things like ochratoxin, which is prevalent in coffee, trichothecenes is prevalent in black mold. Those actually affect complex 1, 3, and 4 of the electron transport chain. So you cannot decouple and then having proper redox potential as well. Now I'm going a little deeper than that, but I really want to have people listening out there, understand the complexity of mold toxins and why we need to really focus on the cell membrane, right? Main discussion a lot of times, and especially like the Shoemaker protocol, Dr. Shoemaker was a pioneer in looking at biotoxin and mold toxicity and how that's related to chronic inflammatory response syndrome. The unfortunate thing is that we need to think further in, right, not out, into where the mitochondria is affected and how mold toxins specifically end up having to impact that.
Wow.
Right. So this can also explain why, some people specifically when they're having severe mold toxicity issues, they have brain fog. Because why? It causes blood-brain barrier leaking going on, right? Because why? Black mold affects the lipid biostructure of your brain, right? Your entire brain is comprised of fat. Specifically, about 80% of it is phospholipids.
Wow.
Right? So all those are getting damaged. And so when you're having lower mitochondrial potential or energy production or poor redox potential, the first symptom that you might be having is brain fog.
That is amazing.
Right.
And with your brain being composed mostly of fat and that membrane is being coupled, like that's a beautiful explanation. The ochratoxin is literally coupling to these electron transport ports in your cell wall, and so you can't produce enough electricity or electron transport. You can't get enough energy, and so that's why everybody's walking around saying, "Oh, I have brain fog. I'll be okay sometimes," and out of the blue, I'll feel like my head's in the clouds. How many people, and this is a general question, do you think that you see that like have mold toxicity? And I know mold's that's one of the infections, but is there a ton of people you think people have mold toxicity they don't even know about it?
So generally, people don't know about having to deal with mold issues until they have gone through so many other practitioners. Like when people come see me, they've gone through 5 to 10 practitioners, and then finding that nothing seems to work. And then when I see them virtually, I do 100% virtual these days, and connecting the particular dots, notice that there is a mold problem going on, right? So, and another second thing I always teach is that, if you done everything and nothing seems to make sense, usually it's mold.
Mold, it's usually mold. And that's like, I remember you talked about this, that your protocols, that most of the mold protocols always jump to getting binders and trying to, lock in the toxins and do antifungals. But you have a different type of sequence, though, that you like to use. What type of particular sequence do you like?
Yeah, absolutely. So that's a good question to kind of lead into my methodology. But one of the specific things is a conventional mold treatment that are going through right now is utilizing binders like cholestyramine or other powerful binders, and then on top of adding in some of the antifungals. And there's nothing wrong with doing that. And a lot of people do get results doing so.
Yeah.
But how do we explain for those people who are completely stuck where they start using binders and antifungals and they get worse?
Yes.
Right?
Yes,
so the
that's a
whole
big
discussion
question.
of cell danger response is the same thing. When the body is not ready to detox, right, that's going to be a big problem. So 3 things I always look at. Number 1 is how is their environment functioning?
Yes.
Right? Environment is the most important part. If the environment is, if the person is stuck in an environment where is still exposed to mold issues, you cannot out-supplement a toxic environment.
Wow.
Yeah. So that's something
Wow.
that we often
good.
forget. So when I see a client from the get-go, like I always assess like how the environment is, right? If there's a sense of moldy environment, that could be a problem. If they're getting overexposed to non-native EMF, that non-native EMF actually can intensify mold growth and release of mycotoxins and people getting really sick,
Wow.
right? So Dr. Klinghardt, for instance, he did
Yeah.
a study about 10 years ago, and he looked at, and this was a presentation he did. The study was done in Switzerland. They saw that mold actually absorbed non-native EMF and was increasing mycotoxin production by 600%.
Good gracious. 600%.
Right. So when you're talking about that overgrowth, but specifically, where's the colonization happening? Mold colonizes in our gut and our body.
Yes.
Right? And when you factor in biofilms on top of that, you actually getting exposed to non-native EMF specifically from Wi-Fi signal, from cell phones, and everywhere else. That intensity of that absorption of radiation causing more mycotoxin to be produced in the body and people getting sicker. So the reason that people are now speaking more about mold toxicity, I believe, and I don't have any data to back this up, but I believe based on what I see, is that the environment that we have at this point in time is not conducive for us to heal because of the EMF exposure on top of blue light issues, like blue light specifically also, like having to deal with these type of LED light bulbs and such. These end up having to affect the circadian rhythm, but more specifically, they're finding now is that it affects methylation process in the body as well. So everything is just overwhelming the environment. So that's why environment factor is really important to assess. But another thing is, let's just say if the person is heavily affected by the environment, it's going to affect the nervous system.
That's right.
So in order for it to, and you say this all the time too, in order for you to detox properly, you need to have a well-functioning nervous system
Yes.
to partake into that. If the body is still ongoing cell danger response and the cells in the nervous system feels it as well, there's no way you're going to be able to properly detox. Because every detox, into the binders and antifungals, those are going to release more issue in terms of the body feeling that there's a certain amount of danger going on and still going to react. Why is it that people doing antifungals are still reacting? It's not because they're herxing, because the cell's not ready for doing that. That's why the sequence aspect in terms of having to have a proper environment and the proper levels in terms of creating safety within the nervous system is a critical part of detoxing, which often this is not being taught in functional medicine.
That's
Right?
crazy.
And then
good.
when you're talking about those aspects of it, how environment in your nervous system affecting the cell membrane, the cellular health is really the critical part that I look at. How I mentioned about how mold toxins causing lipid bilateral structural damages. It also affects how the organ system being affected, how that is leading into cellular issues in terms of creating energy. And so it's a critical part that we look at the environment, nervous system, the cellular impact.
Yes.
So my methodology is called the Encore method. It stands for environment, nervous system, cellular optimization, optimizing detox pathway in the organ system, rebalancing microbiome, and enhancing resiliency. Now, we address the rebalance the microbiome part, which is critical, and I get it as well. But when a person is not ready to get to that route because their environment, your nervous system, and your cellular impact is greatly downgraded, basically,
Yes.
there's no way you're going to be able to kill off that pathogen, nor can you kill off that pathogen when their detox pathway, especially the organ system, is compromised, specifically like
Wow.
biosystem as well. One thing that people, within the energetic and this whole side of the root cause medicine,
Yep.
we know that the bile gets stagnant But mold specifically causes two issues with bile.
Over the past few weeks, I've shared about WaveWatch, a sound frequency wearable designed to help your body rest, rebalance, and heal naturally. In my recent interview with John from WaveWatch, we discussed testimonies ranging from sleep and anxiety to tremors, kidney stones, and PTSD. The frequency sets are rooted in holistic health and frequency medicine. And there's an amazing sleep set designed to play all night, which is based on the Chinese medicine body clock, which will help your sleep excel. WaveWatch is family run by Linda, Joseph, and John, and they truly care about people's health beyond just a product. It's easy to use, non-invasive, and risk-free with a 30-day guarantee. Try today and get $100 off with code Dr. Motley at wavewatch.com/Dr. Motley.
One, it actually stops the rate-limiting step of bile production. So there's a particular enzyme called cytochrome P457A1 enzyme, and mold stops that production from happening.
Really?
Yeah, so the bile production is already compromised. Second thing is mold, specifically ochratoxin and trichothecenes, black mold, impacts something called BSAP, which is bile salt export pump. So you cannot even transport the bile out.
No, is
So-
that why the... Come on, this
So
is
that's the
great.
reason why the bile stagnancy occurs. You cannot even produce it, nor can you transport out. And bile, it's not just about detox or having to help digestion. It's a cell signaling molecule as well. So it affects the entirety of the cell membrane and cellular structure and the DNA and everything else. So reason why I actually like utilizing body bile with TUDCA. TUDCA actually helps with act as a secondary bile salt. It increases bile flow, but also it relieves stress response in the endoplasmic reticulum of your cell.
What?
Right. So there's a whole side of the DNA damage that occurs because of mold toxicity. Right? People don't even talk about these things. And we have labs to back these things up, looking at it. So there's a company called IGL looking at discussion of DNA adduct. And you might be wondering, what is that? Well, DNA adduct, these are specifically damages or structural damages, how the cell membrane and the DNA structure is coming from biotoxin exposure. So they're now seeing that heavy metals, specifically mold toxins, triclosan, right, aluminum, mercury, all these are binding to the DNA
Oh, my
and
word.
the cell membrane. So it causes something called DNA adduct.
DNA adduct.
Adduct, right?
Adduct.
So that in itself. But most interesting part is that our body actually has a natural mechanism to relieve those DNA adducts, specifically the production of butyrate.
So you need butyrate in your gut,
In
don't
your
you?
gut, yeah, exactly. But what's going on when you have mold exposure going on? The butyrate content, especially short-chain fatty acid production, is very low. And so that mechanism to do it on your own is compromised and it's not producing it. So there are studies showing now that when you're utilizing sodium butyrate specifically, right, that is able to relieve that DNA adduct by cleaving it off to relieve that DNA stress response. And there's studies showing in terms of utilizing essential fatty acids and as with butyrate, reversing these type of DNA and cell membrane damage.
So if you took a certain amount of sodium butyrate in the day and you could start cleaving that off the DNA
Correct.
adduct, you loosen them up. And then that way you could start using the TUDCA to help clean up the bile as well.
Bile as well, but one of the things that TUDCA actually helps to do, and you know that it's used in Chinese medicine for 5,000 years,
Yeah.
right? Back in the day, they used to catch a bear. Catch
Yeah.
a bear to get the TUDCA out. It's not how it is, man. It's synthetically bioidentical levels of TUDCA that you're utilizing. What the interesting part about TUDCA is that is able to prevent but also fix the protein misfolding that comes from biotoxin exposure.
Really?
So when you have a DNA damage that goes on in terms of how that's transcribed into producing protein, well, protein misfolding can actually occur.
I didn't know
So
that.
yeah,
Wow.
so this is an intricate part of the cellular health, and why we need to look at much deeper, just rather than just looking at binders and antifungals. There's a cellular damage that goes on, and there's reason why when that's not resolved correctly, there's a persistent cell danger response. Now, I didn't even think about this until I was working with complex cases in terms of like dealing with MCAS, and why people are stuck is because of cell. The cell's not functioning well, so no matter what type of nutrients that you're going to give them, it's going to overreact, or they don't see any resolution whatsoever, or they get worse. So we have to look at more deeply into how these biotoxin issues impact cellular function
Yep.
and how these cellular damages leading into basically improper cell signaling, which leads into more convoluted issue with cell danger response in the body there.
So
Right.
when you're not doing a proper cleansing in the right order,
Yeah, sequencing. basically.
sequencing, and then if say somebody was like, well, I'm just going to take a whole bunch of probiotics at the beginning to try, you're not doing the proper sequence because they're not uncoupling those things from the cell to actually get them cleaned out.
Much worse because when you give probiotic at the wrong time, they react. Specifically,
yes,
yeah,
I've seen
SIBO
that.
patients.
I've seen that. I mean,
Right.
this is like explaining it.
Explaining
Yes.
it. Why? Because that issue is creating more threat. That probiotic creating more threat to the pathogen is creating issue dealing with endotoxin getting released. Right?
Wow.
And then when you're having SIBO, right, you also have CFO, right, small intestinal fungal overgrowth.
Yes.
We know this already. You could test it in your muscle testing.
Yep.
And I see this from the labs, right?
That's
So
right.
we have to look at this in a context way in terms of how these are all impacting how the cells are functioning, how the cells are feeling safe or not.
That's right.
Right. So going back to the whole discussion about TUTCA and how to utilize butyrate, so one of the explanations that I actually utilize is this. You're utilizing butyrate to cleave off the actual damage within the DNA. And then phospholipids, specifically I like to recommend BodyBio PC,
Yep.
comes in, is able to clean up the mess by taking it away and then mending the cell membrane structure.
Oh,
And then you actually have all the bioactive oils, especially like linolenic and alpha linolenic. Specific product I like to use is BodyBio Balance Oil to actually help to fix the inner part of the cell membrane. TUTCA comes in to fix the protein misfolding, so this way it's nicely layered.
yep.
Right? So
Smooths
this is
it out.
basically a concept that I teach about how we have to look at the membrane stack aspect in terms of how to fix the cell membrane.
Wow.
Right? And now these are necessary steps, like I mentioned about the environment, the nervous system, the cellular impact. The cells are also work based on light, right? We have to also look at how circadian rhythm balance is so important.
Yes.
Right? Every aspect of our cells is timely, right? Specifically, digestion is all about the time,
Yep.
right? Your hormone signal is based on time, and that time is determined from the sun. So when I see people who are severely ill, one of the things I actually ask is, what time do you go to sleep? What time do you wake up?
Yes.
And a lot of times they end up having to wake up at the wrong time. They're not waking up based on how the sun is helping them.
Really?
And solar, especially when you talk about early morning light, you're getting exposed to not only getting exposed to naturally occurring infrared, near infrared, right? Those are, and as with blue light, well, these are light signaling aspect of it to tell the mitochondria in your body, and we are photo sensing beings, right?
Yep.
We have photoreceptors all over our skin,
All the skin, yeah.
especially our melanin. And that's going to help to signal the cells to creating energy, but also we are able to absorb the energy from the sun.
Oh,
Another thing that actually does is that as you start to get exposed to the sun properly, you're producing natural occurring melatonin within the cell, not the pineal gland. And that melatonin not only helps to affect changes in terms of your daylight savings, a daylight aspect of it, but it also acts as an antioxidant within your cells to fight off the free radicals. So that's
amazing.
a part that's such an important part out there to get your body aligned to the circadian rhythm, right? And then during the daylight as well. Actually, sunlight also acts as antimicrobial. You actually produce your own antimicrobial based on the sun. And this is how God created.
Yep.
And then the next part is like during the middle of the day, you're getting UVB exposure. Not only are you producing vitamin D, but the full aspect of the sunlight helps to create structural water in the cells.
structural water.
Yeah. So
Wow.
water, you know that it's as energy, as
Yes.
a particulate energy.
Yeah.
But this whole part is conceptualized from Gerald Pollack's work on exclusion zone water, so easy water.
Easy water.
Yeah. So when your body actually produces its own water, about 70% of that production of the water occurs within the cells. So when you're getting proper sunlight, it's able to create that, right? And also another thing that you could see phenomena-wise, as you start to creating that particular energy from the sun, you're creating more electrical charge, more redox. And that exclusion zone, what aspect is that negative ion charge is able to allow proper energy flow within the cell membrane to repel each other to creating energy and flow. So one of the critical parts that Dr. Gerald Pollack mentioned was that use of infrared. They found out that without, and this actually was a study done in a animal model study, they stopped the heart. They allowed infrared light to be shown on a mouse, and they found out that the light created the energy for the blood flow to occur.
No way.
Is near infrared light. We're photomodulating beings, and that's the energy that we're partaking in. That's the most interesting part. So reason why the whole structural water aspect of it has to come into play. Mm-hmm. Structural water or exclusion zone water is a water that our body already makes. Unfortunately, when you have a poor redox reaction within the cell membrane, the water aspect in terms of how that created is poor.
Oh,
right. And we see this when you look at a dark microscopy, for instance, mm-hmm. we see it based on the fact that when the person is highly toxic, the blood starts to clump.
Yeah, totally.
Right.
Yes.
That's the exclusion zone breaking down.
So literally, if your body's producing its own water and you like a certain amount of sunlight, this is great. I'm learning so much. I don't know. I'm trying to get my answer. When you have that exclusionary zone, do you
water, basically.
Easy water?
Easy
do you
water.
Get out into the sun like certain parts of the day, or do you?
So generally, what I would recommend my clients to do is, if they can, nothing fancy, just go outside and have lunch, middle of the day.
Middle of the day.
That's what it is. 20, 30 minutes.
20,
right?
30 minutes.
That's going to help you absorbing that natural UVB to help produce these things in the body. Make sure you hydrate properly as well. I recommend using a structured water device.
Yep.
So there's a great product called Mayu, M-A-Y-U.
M-A-Y-U.
Yeah, Mayu.
Okay, we'll put
and that actually helps to structure the water properly. All you need to do is put the water, filter water into a canteen, and there is a device to help to create voltex in the water to energize it. That's exactly how our heart works.
Yes,
right?
That's right. That's crazy.
Our heart structures the water to begin with. How? When you look at the heart, it's not a muscle just by muscle. You could take the muscle, you could take the heart, you could unfold into a sheet, and within the bidirectional structure of the muscle itself is almost like a vortex, a screw. So anytime the blood getting pumped, you're getting energized.
That is amazing.
With the actual biophoton energy that the body's already creating.
And you're doing that. You can do that with water, get that structure to do the same kind of effect.
Same kind of effect. So that's why when I see clients dealing with mold issues, I could clear the mold issue out within 4 to 5 months, as long as it's not complex. But really getting to the root of the issue, into the cellular health, and allowing the body to heal it on its own. As long as you creating proper bioelectric aspect of in terms of how the body's creating energy, that increasing redox, this is where you're able to see a permanent change into how the cells are functioning and reversing the issue within that. But the thing is, like, if you're creating that energy, you're creating all that, and these are all the works that Dr. Jack Kruse is doing, right? Gerald Pollack, including Doug Wallace, talking about mitochondrial epigenetic aspect of it. Those are all their work. I'm just piecing it all together.
Yep.
You're creating all these energy, but how do you keep that energy?
Yeah, that's
by
a good question.
Cell membrane. So this is where the critical part of using phospholipids, some of the bioactive oils, and also eating healthy, getting proper sunlight, all those are all part of it. So this is the reason why I always love using Body Bio products instead of PC, balanced oil, TOTCA, and sodium butyrate. Those are critical part that I use, but much more than that now. We have to fix the terrain before we go into the cell. And the terrain is your entire ecosystem of your energy.
That is amazing. You're like working at making your cells smooth, like a nice supple outside, unfolding it, creating the proper layers, activating the energy vortex with proper sun, proper water.
Minerals as well. And when you start to make these changes, go eat outside, how much PC oil, like phospholipid, how much of the oils would you need to take? A spoonful a day, or is it like? So it really depends on a person. I've seen clients who are very hypersensitive, so I usually start them very, very low, maybe a drop just to start out and then slowly increase. But to see a meaningful change in the cell membrane and how that is, you have to take at least around 15 mLs or 1 tablespoonful twice a day.
Okay.
So one of the things that I do, in terms of balanced oil, I like to do more of a 1-2-1.
Yeah.
So if you're taking 15 mLs of PC, you should take 15 mLs of balanced oil. And then for TUDCA, I usually recommend people to take it once a day for start, and then you could take it one capsule 3 times a day. Sometimes when you're utilizing anything related to like TUDCA or any of these to increase bile flow, which is critical, but oftentimes if you are very toxic, you end up having to dump more toxin out into the colon.
Yep.
So sometimes you can lead into both diarrhea and constipation. So you got to be careful with that. But generally, like once a day with TUDCA is great for that. Sodium butyrate, 1 capsule twice a day. Maximum dose I tell clients to take is around 3 capsules twice a day.
Yes.
So that's really helpful with that as well. But one of the things that I also like to do is utilizing proper labs.
Oh, yes.
Right? So the comprehensive stool analysis is very important to see and assess how that person's gut functioning. Because if you don't fix that gut, especially that's part of the optimizing organ pathway, you can't fix the mycotoxin issues properly.
You can't.
Because mold toxins, especially mold in itself, colonize in the gut. And people are wondering, how's that even possible? Is because when you're getting exposed to mold in the environment, not only you end up having to ingest to the mouth, right? Because especially when you're sleeping, you're inhaling all that in sometimes. I don't care if you're closing your mouth or not, but you end up having to ingest in the mouth.
Yep.
But also specifically, it can colonize in the nose. So I do recommend doing active nasal irrigation, which is critical. But those spores getting colonizing end up having to now move into your gut. So there's an ongoing exposure of the mold colonizing in your gut, but also those mold end up to produce mycotoxin inside. So when you're talking about SIBO, for instance, or H. pylori infections, and you cannot get a resolution of it, there's usually mold issues there.
That is amazing. And I'm not trying to, I hope I'm not backtracking because it's not, it's making my mind think. It's like, that's why in this area, and I think all around the country, or maybe around the world, you'll find individuals that have like the bile ducts are so clogged, and they'll have like, because you're talking about this mechanism where they'll have stones and sludge, and it's just a diseased gallbladder. And when you were practicing acupuncture, it is amazing to me about how many gallbladders and bile duct issues I see on a daily basis, and I'm not exaggerating it. I'm going to start them on the PC, and I'm going to start doing this testing because, to me, it's blowing my mind. I'm not kidding, guys. This is real. I love mechanisms. I love when you do mechanisms. Now,
and because I have a pharmacy background, and then that, I like to really look at how the mechanism is affecting our body, and really understanding and helping to tell my clients how to connect these dots together to make it more sense.
It makes sense to me, and I love steps. And there's a few things that I remember you talked about too in your conversations about with cleansing. There are a few things that you've voiced your opinion about. That you've talked about things like CoQ10 or NAD about that, and people hurry up and going into NAD, which I've seen people do well with them. But is there a way to apply NAD or CoQ10 when you're doing cleansing?
So specifically, when you don't have a well-functioning cell membrane, right? Let's talk about CoQ10, for instance. Where does CoQ10 actually work? Within the electron transport chain. If you have a compromised cell membrane, that energy production or flow is already affected. So how much of that CoQ10 is going to be really being utilized correctly in that sense of that? But another thing is that when you talk about specific biotoxins, it also affects CoQ10 production.
Oh,
right?
yeah,
so
yes.
That's another thing that especially mycotoxin can create that problem. And then when you talk about NAD is great in certain scenarios, but when you have a biotoxin issues like this, it creates more die-off of these mold to producing mycotoxins and people getting sick. So this is something that I teach my clients and then practitioners as well. The right protocol at the wrong time, creating more mess in the body.
Oh, wow, that's good. That's good, my man. Yeah, that's good. I like that. The right role at the wrong time, causing more. Wow.
Because you see clients coming in, they have good supplements, they have a good dietary protocol, right? All protocol driven. But when we don't understand when these fits in the patient's journey, they get stuck or they get worse.
That's amazing.
Right.
Is that why explanation, though, Doc, that when I do like muscle testing, I do some of my EAV testing, there are certain devices, and you can check if a person needs, like you said, a B vitamin. And when they had mold, their body would totally not react well to B vitamins, and they would want to take B vitamins. That I'm telling you, it's screwing up something. Made like your methylation must be off. And then after like 2 or 3 months, when I was doing cleansing, then their body said, "Yeah, I can take B." That's an explanation for it.
Right, because they're getting out of cell danger response. The whole sense of why the mitochondria is shutting down DNA methylation is to stop stop from further damage within your cells. So it's already a protective ways into how the mitochondria is functioning, and then you're pouring B vitamins at the problem. You have to understand what the patient's journey is.
That's right.
Right? How unstable their health is. So I give this whole Humpty Dumpty analogy.
Yep.
If the Humpty Dumpty is sitting on a wall, it's fine, but that little stressor coming in could be poking that Humpty Dumpty, and then you're falling over. That's
right.
exactly how a lot of people are walking around these days. And reason why they get exposed to mold, or they might be kind of gotten a viral infection, and all of a sudden their life is just completely upside down. Because why? That unshaky, less resilient cellular health is impacting what it is. So even though I'm here to talk about mold, but one of the things that we have to also understand is that everything is interconnected into how body's functioning.
That's right.
And the most important thing
right.
that I teach my clients is that you have to create cellular resiliency.
That is amazing, my man.
Right.
Because like you have to have your cells be resilient and be able to detox at the proper time to actually clean it.
Clean it. So this is the reason why I came up with the whole Encore method, to really giving my clients a sequential roadmap. That you have to work on the environment and your nervous system and your cellular health to optimize your detox pathway correctly, rebalance the microbiome, and the last part is to enhancing resiliency, to teach them the tools so that they could live their life fully. And one of the things I jokingly say to my clients is this: at some point, I don't want to ever see you again. Not because I don't like you, but you got to live your life. You shouldn't be doing detox work for 5 years. That's not life.
No.
Right? And this
not.
is what people are doing a lot of times. Just running around, looking at different Instagram, different pages, different podcasts, and then just trying to piecemeal everything and trying to get their health back together. There's nothing wrong doing that. But when you don't have a proper sequential roadmap,
Yes.
nothing's going to work very well. And that's the reason why I always focus on the environment, nervous system first. And the reason I came out the nervous system is this: I went through my own childhood trauma. I didn't realize, living in a narcissistic Asian household, end up having to, and I'm quite sure you've gone through it as well, and how that impacted our health. And that overall sense of going through a danger state on my own, like trying to sense like when the next particular danger is going to be and how the environment is going to affect me, that in itself created so much neuroinflammation that I didn't even realize.
Yes.
Until literally 4 years ago, when I was just starting to work with clients dealing with MCAS and severe issues, I decided to reflect on my own health journey. Like, yes, I cleared the biotoxin issue out. I mean, I cleared mold and Bartonella within 2 years, but I was still not being optimal in terms of my health. So what is really happening there? It's my nervous system. If the nervous system is still stuck in that fight or flight state, no matter what kind of supplement you do, what kind of, anything that you decide to do, that's not going to work very well.
Yes.
You have to really retrain that nervous system. So this is the whole vagal nerve theory comes into play. EMDR, somatic work, right? Primal trust really helps us there. One thing that I teach my clients is doing heart coherent breathing technique is really impactful.
Yeah, what is it? Like
Heart math.
Heart math.
So heart math is really helpful. This is a really easy technique that anybody could do, but what it does is trying to create coherency in the body and working to relieve and improving the heart coherency and heart variability. So HRV, for instance, heart variability, people out there understanding that, wearing your Oura ring, measuring your sleep, which is the small part of the picture. What HRV really measures is your resilient state and your autonomic flexibility to go from sympathetic to parasympathetic.
Yes.
So the higher the number of HRV, you have a better management of flexibility between sympathetic and nervous system state, and then go into a parasympathetic or relaxed state. But oftentimes, people dealing with these biotoxin issues, and I could tell you exactly why, when you're dealing with mold, it actually creates more microglial activation. So you have a neuroinflammation that's already going on. You're already in a heightened response state. So that's going to be more sympathetic. So when you see biotoxin people, people dealing with biotoxins, their HRV rating is very low.
Yeah, very, very low.
Very, very low. This is the reason why. So where this whole heart coherency comes in is that heart coherency is teaching you to utilizing positive renewal energy and feeling to improving the HRV. It's very simple. All you need to do is close your eyes and think about what's making you happy, joyful, and grateful about. That's it. That's all you need to do.
Happy, joyful,
and grateful. Positive feelings. So when you're closing your eyes, when you have a positive renewal feeling of love, happy, and what you're grateful about, your body does not sense whether you're dealing with a small stress or light or big stress, nor can your brain perceive whether you're dealing with physical stress, mental stress, or emotional stress. So when you shift that feeling, that positive renewal feeling of what you love, happy, grateful about, you're creating coherency right off the bat.
It's like from the brain right to the heart. And the mind. It's just like really coherent.
Okay. And then your heart actually has 40,000 different nerves. So it senses and it gives you intuitive feelings. So you're tapping into the natural nervous system that you already have, right? By creating that coherency, based on that positive thoughts. And then you're breathing inhale through the nose and you're exhaling out. And if you do that for 5 minutes straight, twice a day, I'm telling you, you're going to be a changed person. And I've seen this numerous times from my clients. I had a client I had a client who actually unfortunately had a very unfortunate circumstances where she lost her child, going through heavy bouts of depression and gut issues, hormone out of whack. Well, she was not ready to go through working with me. So the only thing I taught her was doing heart coherent breathing technique. After 6 weeks, I saw her virtually. And her resting heart rate, she told me, used to be 90 down to a 60, and her face was a changed person. It's starting to create more vibrant energy and light.
That is amazing.
Right? Because that coherency state that we're creating. But unfortunately, when you're dealing with these type of biotoxins, all these types of stress response, end up having to quench the light that we're generating.
Oh, quench the light.
Right.
That is right, my man.
Right.
That is so good.
We are a light being, but we also create our own biophoton energy. And when you are dealing with those type of stress, trauma, all these little things into the biotoxin problem, that heaviness of life is quenching that light. So what we're trying to do as a practitioner is to recreating that particular light and creating that particular energy. So this way you're able to live your life to the fullest. And I don't think functional medicine yet is able to teach that.
No, I don't think so either. And I think that I love it when you're talking about coherence. Like you have to be coherent with your heart. Like you have to have that connection to actually create that healing biophotonic energy. I'm telling you, I'm doing I have my infrared sauna, and I'm going to do it every single morning. And I'm telling you, you are a wealth of knowledge, my man.
Yeah, I'm super excited about this. You could see from my
I love
my
this.
voice. But I really want to change how functional medicine is being practiced these days.
That's right.
It's because, we go to these different conferences, you get different protocols, but it's all protocol driven. We don't really particularly ask the question in terms of how are you living, right? How's your environment? How's your nervous system?
Yes.
Right? And you know this energetically. You see that if people are stuck emotionally, those emotions get stuck in the liver and your gallbladder.
That's right.
You can't release it.
That's right.
So once you're able to even getting through the whole nervous system aspect and creating that coherency, oftentimes you could detox naturally. I've had clients, I had this one lady even mention about she's gone through fascia and trauma release, and she released tons of parasites.
Dude, I love that.
Right?
Because coherence between with getting connected and releasing that emotional trauma. Oh.
Yeah. So that even parasites alone, let's just say, whole craze about not eating fish. I'm not a fan of it. I love fish. I love eating sushi. But one of the things that we have to really talk about is that if you have a well-functioning cell membrane, your mitochondria repels parasites.
I love sushi too,
Yeah.
and I'm just telling you what, I'm half Korean. I love sushi, and you give me a little wasabi. Sorry.
So it's okay. One of the things that there was a study that was done, they're looking at toxoplasmosis, which is obviously very toxic parasites. They noticed that toxoplasmosis end up having to eat off of the fatty acid that the cell membrane is utilizing.
No way.
Yeah, so that's how they grow. They feed off of it.
No way.
They feed off of it. So what cell membrane is trying to do is trying to outcompete in doing that, but they notice that mitochondria comes in, blocks that from happening. So when you have a mitochondrial dysfunction, what's more prevalent? Parasites. So the whole discussion about parasite cleanse, I get that. I do it as well. But that shouldn't be the main focal point to detoxing somebody. The focal point should be, how do we create cellular resiliency to creating more energy so that we could repel these issues out? That's what I'm teaching my clients in terms of creating that energy within you. Right? It's not some mumbo jumbo. It's completely scientifically driven what it is. And that's how body is supposed to function.
I mean, you're shifting the way I think about with even when I'm cleansed. I am not kidding. I'll be talking with you tonight where this is going to be, I will just shift people to you. This is like, oh my goodness. That, I mean, with the mitochondria blocking that is like mind blowing. And people, I'm serious. I get super excited about this. Okay.
Yeah, this is what the mitochondria does. Like I said, as long as you give the right tools, the mitochondria could do it for itself.
It's such a defense
Unfortunate thing
mechanism.
is that
Wow.
when you have a overwhelming response to stress, the body's not able to get back to the homeostasis, and the mitochondria doesn't know what to do.
That is,
Right.
that's right. Okay, you need to write a book, and I'll be the first person to. I'm not kidding you. Wow, man, brother. Okay, first of all, we know that you're going to. If somebody wants to get a hold of you, if they know they hear this,
Yeah.
and they got to get a hold of you because they think I may have mold or some of these.
Yeah,
how do they get in contact with you to start working with you?
Yeah, absolutely. You could go to my website, drjohnkim.com.
Yep.
Somehow that URL was available.
That's awesome. No, I mean really. I was gonna say, like, do you get it? I mean, yeah, that's good.
Somehow that was available. So I just changed my website to drjohnkim.com. You could definitely go there. You could learn about my Encore method, and then as well as have a free community you could join.
Yes.
And you could book a call if you like. So that's really available there. And I'm going to be opening up very soon in the month of September, Encore method practitioner mentorship.
Yes.
So anyone out there, new practitioners or practitioners who've been doing this for a while and not knowing how to navigate or feel that everything's overwhelming you, this is where teaching about the Encore method is going to really help you, giving the sequential roadmap to apply into every single of your patients.
Wow.
Right.
November?
September. Yeah.
I'm going to tell my assistant to get that. This is like really changed my world. I'm not kidding.
I mean, that's how I see these. I mean, even let's just say a patient comes in, I even utilize the Encore method to really see and try to connect the dots into what the patient's going through. I ask about the environment, the nervous system, how's the cells functioning, right? How's that detox pathways functioning, rebalance the microbiome. But then I utilize the Encore method to rebuilding the person from inside and out, right?
Because you're getting at those steps, and I'm scientific driven too, my man. And you're at John Farm MD, right, on Instagram?
It's John.farmd. You can find me on Instagram on John.farmd. If you are wanting to work with me in that capacity, you can reach out to me anytime. I'd be happy to discuss.
Guys, I'm telling you, this has been good, brother. I'm not kidding, Doc. This was amazing. One of my best podcasts by far. No joke. I've learned so much.
There's a reason why our episode got lost.
I'm telling you, our episode, we called the people that had, and they did not get back with us. They didn't even have it on the file. I was like, I don't know what happened, but this has been amazing. Please work with them. That's all I'm going to say. And I'm just so thankful you brought your knowledge. Anytime, like, hopefully you move to this town or you're close and we can do more in person. This has really been amazing. A wealth of knowledge, guys. And if you have anybody yourself or know anybody that needs cleansing, healing, mold, parasites, please work with this gentleman right here. It's going to be a great experience. I'm telling you, I'm still thinking about the thoughts. And we'll talk about it more even later. Yeah. Guys, from all of us here at Ancient Health Podcast, thank you so much. If you know anybody, send them this podcast. Go follow Dr. John. Make sure that you get people following him because this is really good info. He has great information online. I'm so pleasured and so grateful that you came down here and talked with me today. Guys, from all of us here, we tell you good night. Have a great day.
Thank you.
Before we wrap up, please remember that the information shared in this podcast is for educational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed through this podcast, and the use of information here or materials linked from this podcast is at your own risk. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider before making any changes to your health regimen, and do not disregard or delay seeking medical advice for any condition you may have. Our content may include sponsorship and affiliate links, through which we earn a small commission on sales made through those links. Thank you for joining us today on the Ancient Health Podcast. We hope you've gained valuable insights into the harmony between Eastern and Western medicine. If you've enjoyed today's episode, be sure to subscribe, share, and leave us a review. Remember, true health is about balance, mind, body, and spirit. So stay tuned for more episodes where we continue to explore how ancient wisdom and modern science can work together to help you thrive. Here's to your health, balance, and well-being. I'm Dr. Chris Motley, and I look forward to our next episode together.